Well, we continue with Adelheid. Adelheid presents and she states, I cannot do sports. I'm so stressed, I'm so tired, and it's simply not possible anymore. Adelheid is 62 years old, and performing an echocardiographic exam, we do see first a very striking, relatively rare pathology, so to speak. She has a hypoplastic posterior mitral valve leaflet. So first of all, we have to note that the left ventricle looks somewhat weird. The basal parts, the septal parts, they look hypokinetic, but overall, very strange looking left ventricle. Furthermore, the anterior mitral valve leaflet is elongated and there is a very, very small posterior mitral valve leaflet. So this is truly hypoplastic. In this case, there was not a relevant mitral regurgitation present, so not severely pathological, definitely not explaining the symptoms. We have to move on and evaluate the right ventricle. And in this case, we do see there's a small pericardial effusion. The atria, they are dilated. She also has atrial fibrillation. And we do see a structure in the right atrium. They are so-called rete Chiari, or Chiari network. This is a mesh which is sometimes still existing in adults. Normally, you don't see it, but in this case, you can see quite nicely over here the Chiari network. It's very often confused with the Eustachian valve because they look relatively similar. So overall, in this case, they are inserted over here. Now, looking at the tricuspid valve and the right ventricle, it's also looking weird. The entire right ventricle, its function seems to be reduced. It's definitely a weird shape as the left ventricle. The tricuspid valve has, I would say, somewhat of a tricuspid annular disjunction, but there was no significant tricuspid regurgitation. The right ventricle isn't dilated though, but it seems to be compressed. So in this case, the reason why the heart looks weird and somewhat different, the cause was a so-called Trichterbrust, the pectus excavatum, also called funnel chest or cobbler's chest. This can be hemodynamically relevant. Also in our patient, the right ventricular function seems to be reduced. She had dyspnea and she also had an elevated brain natriuretic peptide. Sometimes those patients are very, very hard to scan, so it's not always easy to visualize the cardiac chambers with echocardiography. In this case, overall, her main problem was burnout symptomatic, so a psychological problem, but still with heart failure therapy and a little bit of diuretic therapy, symptoms and the brain natriuretic peptide definitely improved.